We are seeing somewhat higher case counts from coronavirus in Philadelphia so far this week. Now, our case counts fluctuate day to day, and so we need to see a few more days to determine if that's a trend. I'm going to update you briefly on the case counts, and then I'm going to talk a little bit about masks and a little bit about ventilation. So here are the numbers. Since this time yesterday, we've identified 185 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 31,910 since the beginning of the epidemic. Now, that's a large number of cases. We also got a large number of test results in since yesterday, 3,719, specifically 3,719. And so the positivity rate was right at 5%, which is slightly higher than we've been running over the last week or so. Since this time yesterday, we've identified no new deaths from the coronavirus infection. Our total death count is 1,709 since the beginning of the epidemic. We did yesterday report that we identified 9 new ones when we do our roughly weekly data match. So we pick up identification of deaths usually about once a week through that. As far as testing in the city, we are still seeing, unfortunately, long delays in getting test results from one laboratory, the laboratory known as Quest. The turnaround time is on average about 8 days, which is far too long. But the other major laboratory that's doing community-based testing, LabCorp, has a turnaround time now of about 2 days, which is good. And the other laboratories in the city generally are turning around results in 1 to 2 days. So most people are getting the results in a fairly timely fashion right now. Let me give you an update a little bit on where we are with contact tracing. We are making progress for that. So here's data for what we did in contact tracing last week, the 7 days that ended on Saturday, August 8th. There were 718 cases that occurred during that week, of which 65 were managed by partners. That is to say, other organizations that are doing their own contact tracing. Of the remaining 653, 65% we reached and they agreed to participate in contact tracing. That's great. 4%, we never got a phone number. That's not good, but that 4% is lower than we were when we did this before. 25% we were unable to reach. That's lower than we did before. And 4% refused to participate. Of those people that we did interview, about a third reported no contacts. Either they had none or that they couldn't name who they were. Of those reporting contacts, they averaged about 3 contacts per case. And of those contacts that we got from those interviews, we were able to reach and get to agree to quarantine 77%. So the process is working well for a lot of people. It is not working for everybody. It is working well for a lot of people. And there's more progress we think we'll make with that. Now, the other benefit of the contact tracing process is it gives us information from the cases about how they might have been exposed, which can help guide us as far as our overall response to the pandemic. Of the cases that we interviewed, 41% believed that they knew the person who they got the infection from. It was typically a household member. And 18% said that they traveled out of state. So there's still probably a decent number that are getting infected from travel, but that 18% is lower than when we reported this before, when it was 27%. Now let me talk a little bit about mask use. Remind everybody that mask use is important as ever for people to wear right now. We still have plenty of virus in the community. That's a very simple step that can prevent spread from one person to another. So if there's one thing you can do to try to really help yourself and others in the community, commit to wearing a mask when you're around others. I got a question though at the last press conference about the value of what's called gaiters. These are pieces of material that are in a cylindrical shape that you wrap around your neck, people around their nose and mouth. And because there was a study that questioned whether those gaiters were effective in preventing the spread from one person to another. So we reviewed that study. Now that study has its limits. It was designed to show the value of a machine used to test masks, not designed to evaluate masks themselves. And so there definitely limits to the value of that study. Still, the study did suggest that we should at least look into the effectiveness of different types of masks as far as their likelihood of preventing droplets from going from one person to another. So we at the health department will be reviewing other studies of masks, and there are other studies out there. And we're going to be offering more detailed guidance later. But we thought we'd give you some advice right now because this issue has come up. My first message is if you're wearing any type of mask at all, thank you. You're doing the right thing. That's the most important thing. But if you want to know what are the better types of masks, here's some basic principles to go by. First, a tighter mesh is better than a looser mesh if you're using some sort of cloth material. How do you know if it's a tight mesh or loose mesh? Hold it up to a light, and if you can see lots of light between the weave, it's probably not as tight as it ought to be. Second is use a mask that hugs your cheek and around your chin so there are no gaps for the droplets to leak out. So that means that like a handkerchief around your nose there isn't going to be quite as good because there's space below your chin where the droplets can leak out. And the third is when you're wearing any type of mask, make sure it covers both your mouth and your nose. I see a lot of people with good masks that are letting it drop down and it's not covering their nose. Doesn't do you any good, or doesn't do the people around you good if you've got a great piece of material for your mask. It's not covering your nose where droplets can go out from or it can come in too. So that's where we are with masks. Now let me talk a little bit about ventilation. You know, there are continued questions that you've probably read about among scientists about whether the virus can spread through the air in what's called aerosols. Aerosols are very small droplets that you generally can't see because they're so small that travel through the air. And there are related questions about, therefore, the importance of ventilation or air movement for reducing the likelihood of spread of the virus from one person to another. Now, I think everyone agrees that the main route of transmission of this virus is through fairly large droplets from one person to another person nearby. You know, we haven't heard of outbreaks where an infected person passes this infection from one room to a person in another room, even though the air does travel from one room to another room. So it's still the case that masks are by far the most important thing you can do to prevent spread. And then having a physical distance from another person is the next most important thing you can do. So it's unclear, though, if aerosols can sometimes cause spread. And it's unclear, especially if people take these other precautions, if people are wearing masks and if they're keeping a distance. So let's call spread through aerosols not a risk, but a potential risk. And to protect against that potential risk, it does make sense to increase ventilation when it's possible. Now, people have asked us, well, what does that actually mean? How would they do that? So we are posted guidance on our website on ventilation, and we're going to be incorporating that guidance, our guidance for specific situations. And here's the basic idea, that if it's possible, and it may not be possible, but if it's possible, you can increase ventilation in a building by one of two ways. The first way is to simply open windows and or doors on two sides of the building so that air flows through the building. And that can get a lot of good ventilation through that. The second possibility is to optimize the ventilation in the building's heating, ventilation, and air conditioning systems, or HVAC systems. You can do that by first adjusting these systems to increase the total airflow. Second is to increase the amount of outside air that is mixed into the air that is circulated. So the building isn't just recirculating air from inside the building. And the third is to put in a filter so that it can filter out at least some of the droplets that would go through the system. Now, some people have asked about some very specialized filters that are called Hepa filters, or high efficiency particulate air filters, where they've asked about ultraviolet lights in their HVAC systems. We don't think that those are necessary. And some people have thought, well, if we do that, does that mean that people don't need to wear masks? And that's not true. No matter how good your ventilation system is, it's not a replacement for masks, not a replacement for people keeping distance. So still, the most important step for everyone is to mask up. Before I finish, the final thought about masking up. Our Mask Up campaign is going on around the city right now. I hope you've seen it on the sides of buses and other places, and you may have seen it on social media. You see that image over my shoulder. When we launched our campaign, a number of people asked us, how can I get that mask? And to be honest, when we launched the campaign, there wasn't a mask like that. It was just an image. But because we've gotten interest, we have now created masks. They look like this. I hope you can see this. And if you want to get a mask like this so that you can promote the idea of masking up for everyone else, you can purchase these. Just go to bit.ly/maskupphl. That's bit.ly/maskupphl. You can purchase these masks or masks with our other slogans. And a part of the proceeds from these purchases goes to support the Black Doctors COVID Consortium that, as you know, is doing community-based testing across the city. So you can support the idea of masking up and support the rest of our response at the same time. If you want to know more information about anything I've discussed, go to our website, www.phila.gov/COVID. Thanks.
Good afternoon, Dr. Farley. I have a couple of questions for you. Dr. Fauci has said that he's concerned about hospital capacity as COVID and the flu season collide, and I'm curious how concerned you are about that locally.
Well, we got through the first wave with the hospitals being very full. That was tight, but we managed to get through that. I would think that there would be enough capacity if people, wear their masks and if people get the flu shots. But we're going to watch that closely. We are in very close contact with the hospitals. The way to do that is if we have any sense that the hospitals may be filling up, the hospitals can cancel elective surgeries and other optional hospitalizations, and there are a decent number of them, so we can make additional bed space. So I wouldn't say it's impossible. It could happen, but I'm hopeful that we won't get to that point.
The finances in hospitals have obviously been a challenge with canceling elective surgeries. How does that play into preparation and the conversations that you're having about preparing for flu season during a pandemic?
I don't deal with the finances of hospitals. I certainly talk to the folks. I'm sure that they have to address those problems. But certainly the people who are making the decisions in hospitals know they've got to be saving lives first. And so they'll make, if they have to cancel elective surgery in order to make room for patients with flu or with COVID, they absolutely will do that.
And one last thing, sir, where do you stand on local hospitals doing rapid testing in Philly? I know you said that getting testing results seems to be a little bit better than it was, but are they going to be helping to test using their rapid tests in minority or at-risk communities?
Well, first, let's just clarify what we're talking about when we say rapid testing. Hospital laboratories are doing testing using the typical PCR technology that takes, under the best of circumstances, 6 hours or maybe 12 hours. And they are doing that. They have a limited capacity. We are talking to them about how, if we might be able to tap into that capacity so we get a quicker turnaround for community-based testing. Separate from that is this new technology of tests, these antigen tests, which can give a result in a matter of minutes. But the major problem with them is that the accuracy with those results. So right now, we're not encouraging those antigen tests. When we get one that has a higher accuracy, then we might very much change. So we are going to, as much as possible, direct testing to laboratories that have a quicker turnaround using the standard PCR tests. That would include hospital laboratories and other local laboratories. Not there yet, but we're still working on that.
Are the hospitals going to be involved, do you think, eventually locally?
Well, they're involved right now. A number of them have community-based testing sites, and they do a fairly high volume. We're talking to them about ways to make that even more accessible.
Carolina tells us that she was checking precisely the data this morning, and that it shows that lots of infections in under 20-year-olds, which are considered pediatric cases. But obviously, she wants to have some understanding for her audience and some recommendations, given that the trend shows that children have been infected. And according to the definition of the CDC, minority contagion rates are higher, especially for Hispanics and Blacks in the community. So since those trends and those rates have been going up, what recommendations can you issue to the community in dealing with this, specifically infections in children?
Well, in general, children handle this infection very well. They often have no symptoms at all, and if they have symptoms, it typically is pretty mild and they get over it. We had very few severe outcomes in children. So we can get you the data on them. The overall recommendations for how to prevent infection in children are the same recommendations as we have for adults. The children should wear masks too when they're around other people. I know it's not easy with the small children, but many children can do this. And they should keep a distance from people, and they should avoid crowds.
Las recomendaciones van a ser similares a las que tenemos para los adultos, y obviamente cuando los niños se infectan no son síntomas tan severos por lo general, aunque sí ha habido casos que lo han sido y se recuperan más rápidamente. Tenemos esos datos y las recomendaciones son iguales que para los adultos. Igualmente, mantener la distancia social, utilizar la mascarilla, aunque sea difícil para niños menores.
Thank you.
Thank you.
Great. Thank you, Carolina. And let's go now to Laura McChrystal of the Inquirer.
Hi. I'm wondering, first of all, Dr. Farley, if you could comment on whether the contact tracing has given you an idea of where most people with new cases are picking them up, whether it's at work or social gatherings. Do you have any idea on that?
Yeah, we spend our time looking through the interviews to try to look for patterns like that. And so what has struck us is, again, how, as I mentioned, how many people know the person that infected them, or at least they believe that they do, that they're getting it from a household member. So that's a common situation. How high the travel, reporting travel is. So we think a fair number of people being infected through travel. We continue to hear about social gatherings. We don't hear so much about occupation, or not so much patterns around occupation, but I think we need to do a better job of classifying our data to look for patterns. But the key message so far is we're not finding evidence of transmission at the sort of sites that we have opened. For example, barbershops and beauty salons, let's say, that would make us concerned about those sites.
Okay. And I'm wondering, I mean, in some other cities and states, we've heard of, single events that have been linked to a number of cases, like a party or a large gathering. Has your contact tracing uncovered any of that here in Philly, like a single super spreader event?
We have not identified any event where there's a large number of people who've been infected. There's probably been some social gatherings where there may have been, a small number, 2, 3, 4, but not have identified any large ones.
Hi, this is just a question for Dr. Farley. Dr. Farley, just wanted your response to this. The director of the CDC saying the upcoming flu season could compound the pandemic crisis. He says this could be the worst fall in U.S. public health history if people don't take precautions like wearing masks. So we just wanted to get your response to that.
Well, he's absolutely right that we should be wearing masks. The question is, how is the coronavirus going to behave when we enter flu season? Most respiratory viruses get worse in the fall and peaking around January and February, the typical flu season. And will coronavirus behave like other respiratory viruses? If so, then it could be very bad at that time. If people wear masks, though, and do this really diligently, then we might be able to limit the amount of coronavirus as well as the amount of influenza that we see. So I'm not going to predict whether we're going to get there. I will say focus on the prevention. So the mask is important, but also remember that flu shots are going to become available soon. And so it's a good time for people to commit to getting their flu shot.
My question is for Dr. Farley. Just a few questions, and it's related to contact tracing. I'm not sure if you're aware, but the National Association of City and County Health Officials, they recommend 30 contact tracers for every 100,000 people. By that metric, based on what we know Philadelphia has, you've hired about 119 people. Is that enough to be doing contact tracing in the city of Philadelphia?
Yeah, I'm aware of those, that ratio that that organization put out. That would involve a very large number of contact tracers. I don't know if you calculated it out, but it would be in the hundreds. And I think, we that's probably more than we're ever going to be able to hire here, given our funding capability. We have hired 100 or so. We're going to see how it goes. If we feel like hiring more makes sense within our budget, we will do that. But we also need to recognize that contact tracing is just one piece of an overall strategy. And as you see from this, it's not a perfect strategy. You're not going to be able to find every case. You're not going to be able to get everybody to cooperate. And so it needs to work with the other parts of the strategy.
Do you feel like the 100 or so people you have hired so far is enough? Do you feel like you're able to reach all of the contacts that are provided to you?
Well, we have enough now to where we can attempt to reach everybody. And the question is, if we had more people, would we have greater success in reaching those? And we don't know yet. All of our people are newly hired. The whole organization is new. And so it's going to be improving, I think, every week. If we feel like more people will help us get to people more effectively or sooner, then yes, we will hire additional ones. But I think I want to see how well the current organization functions before we make that call.
One last thing, and this was part of the numbers you put out today, and I just want a little clarification to make sure I heard this correctly. I believe you said that of the people you were able to reach, the 65%, about a third said that they didn't have any contact. What does that mean? I mean, how can that be? I guess is my, are they in nursing homes? And so it's people and no one is coming to see them except staff, or are these people being truthful or untruthful?
Yeah, they either said they had no contacts or that they said that they couldn't give us the names of any contacts. I don't think that they're being totally truthful. I think they're basically not cooperating. People are reluctant to give us the names of folks that they've been around. There's a lot of fear and mistrust out there. And so we are encouraging people to work with us. And we hope that over time people get familiar with us and understand that our contact tracers are only helping. But there is definitely reluctance to participate. Now, not on the part of everybody. Most people we are able to contact, they are working with us. But there is a sizable minority that are not yet.
I mean, that's about a third of the people you reach who said, "Oh, I don't know, I don't come into contact with anybody." I mean, that's got to be a real problem.
That is a problem. Yep, we want more people to cooperate with us. Yep.
What's the message to send to them?
Go ahead. One last question, Rosemary. Go ahead.
Just that. What's your message, Dr. Farley, to people who may get contacted, who may be contacted by your staff down the road, and you want them to cooperate?
Yeah, we want people to recognize the health department is only there to help. They'll help you. They'll help your relatives. They'll help your friends. So work with them. I said that in a press conference a week or two ago. We're just going to need to reiterate that message. We have also on our website videos of our contact tracers, so you can see that these are not scary people. These are nice folks just like you and me who only want to help, and we hope if people see the humans behind this, that they're more likely to participate.
Thank you.
Thank you. My question is for Dr. Farley. As you see right now with the college football landscape going on, with a lot of conferences decided to postpone their sports, the only Division I school here in Philadelphia for major college football is Temple University. Do you recommend to them that they should not play their season this year?
Yeah, we are recommending that nobody does competitive sports between teams. That would include Temple's football team.
And secondly, this is for you and for Mary Kennedy. Do you guys have a deadline when you are going to notify the Philadelphia Eagles about if they're going to allow fans into the stadiums this season, as their home opener right now is scheduled for September 20th?
All I can say right now is they, under our current rules, they would not be allowed to have fans in the stands. I would say it's going to be unlikely that situation will change by September 20th.
And final one for Mayor Kennedy. As you know, the city of Philadelphia hosts a lot of unique sporting events. One of the big ones that the city draws every year is the Army-Navy game, which is right now set for the second Saturday in December. Do you believe that could be going on this year?
If the numbers continue to improve and it's medically safe to do it, yeah. And if it's not medically safe to do it, no.
One final one for Dr. Farley. Has any other high schools in Philadelphia reached out to you about Governor Wolf's recommendation about no high school sports? And have you had a chance to look over the governor's recommendation about no high school sports this year?
I have looked at his recommendations. I agree with those recommendations. We have talked to some high schools, and all the ones that I've spoken to, we're not going to be having competitive sports. And their teams may be practicing and doing drills, but they're not going to be doing competitions. Maybe some high schools out there that are planning on doing competitive sports that I'm not aware of, but not the ones that I've spoken to.
And this is one final one for you and for Mayor Kennedy. There's a link in the MLB's player manual that says that if a particular team wants to have fans in the stadium for, say, if the Phillies were to make the postseason this year, they would need approval from Major League Baseball and the city of Philadelphia. Would you sign off on that?
What was the question again? About fans in the stands?
Yes, there's a clause in the MLB operational manual that says that if a team wants to have fans in the stands, they will need approval by Major League Baseball and the city itself if they were to allow it. Say, for instance, if the Phillies were to make the playoffs this year, would you sign off on them allowing fans in the stadium this year?
If the medical advice and the scientific advice is it's safe, yes. If it's not, no.